Okay, these are my checkoffs. Beautiful. Okay, I'm gonna start now. Hello, my name is Katie. I'm a nursing student with Newman. I'm gonna be doing a wound change today. I have a couple questions to ask you. Can I have your name and your date of birth for me? Okay. Jean Holland, date of birth 7/20 of 1950. And your medication allergies? Penicillin. Like I said, we're going to be doing a wound change today. Are you having any pain right now? No? Okay. Well, I'm going to go ahead and look at your wounds. I'm going to get some gloves on. Okay. So we actually don't know when this was last changed because there's no label on it. But I'm going to just go ahead and take off the dressing. Okay. There is no redness, no edema, no ecchymosis, and no drainage. And then I'm going to take out your packing, okay? Okay. And then let me throw this away and get some new gloves on. Okay, I'm going to open my sterile kit after I perform hand hygiene. I'm going to pretend to perform hand hygiene because there's one over here. Okay, now I'm going to open my kit. Going to remove my gloves. And then I'm going to dump my bucket out. Okay. Then I'm going to take my water here, dump a little bit out here. Okay. I'm going to put it in two spots here, one for the packing and one for the 4x4s to clean. I'm going to open my packing strips. And now I'm going to put on my gloves. Give myself some room here. Okay, now I'm gonna lay some 4x4s in here so I can clean the wound. Then I'm gonna take my forceps and my scissors, and I'm we're just gonna cut that piece off. And I'm going to put it in the water Then I'm going to take one of my 4x4s here. I'm just gonna clean off the wound and then I'll put the alcohol swabs on it here in a second. I'm gonna start more towards the inner part and do one circular motion. And I need my biohazard bag. This would obviously go in place before I started my wound change to throw my dressings in there. Then I'm going to go a little farther out on the wound. And I'm going to get some alcohol swabs. And one at a time here, again, inner to outer with one swipe per swab. A little farther outer and the most outward part. Okay, once that is done, then I will take my packing strip and get it straight. And then I'm gonna put one end on my finger so I know where the end is. And then take my cotton swab and roll it a roll and a half. And then, let me roll that one more time. And then unrolling it in the patient and then taking packing. And you want to leave a little bit at the end so that we know where the end is. And then I will take about 3 4x4s, 1, 2, and 3, and place them over, not touching the middle, and placing it. And then I'll take my ABD pad with the blue pointing upward and fold it in half without touching the center, and then lay it on the wound. And then some tape. I'm not going to tape down all 4 sides just so we can have some air movement in there. I'll fold it back over. I'm going to leave the bottom side open for air. Then I'm going to label date 10/21, time 14:46, and by initials. And then I will just place it on top of it so that the next nurse can see it. When I'm all finished, I will go ahead and pack my things up, and I will dump this, obviously, but for the time being, I guess I'll just put my stuff up there. And I will throw it in the trash. Perform hand hygiene. Go back in. Knock, knock. Cover the patient up. Take my bag away. Is there anything else I can get you? No? Okay, thank you.